Ernest, it's my great pleasure to introduce and welcome Lord James Bethell, a former health minister and huge advocate for prevention and for our cause, the author of the foreword to our white paper towards a healthier, happier Britain, the case for health coaching, and newly appointed as a trustee of the Royal Society of Public Health, plus an all-around good guy.
Thank you very much indeed for a really inspiring introduction to this session. And thank you to Faye as well for this very, very kind invitation to speak. As Isabella said, part of what we face comes from politicians and from policymakers, and I'm just going to give you 2 minutes on my perspectives as a former Minister for Health on where you, this group, fits into our answer to the country's massive health challenges. And the truth is, as a former minister and as a member of the House of Lords, we are really daunted by the tsunami of ill health in our country. It holds us back for our economic development, in our communities, in our families, and it has become the #1 concern of families. Now, cost of living is probably comes up the most, but after that, health is the thing that people bring up time and again when they're talking to politicians. But politicians don't feel that they have the answers. They think that they've been told by clinical professions that the answers are more hospitals, more doctors, more nurses. That's the mantra that you've heard from politicians from all parties for decades. And the amount we spend on the NHS has gone up from 85 billion to 213 billion in this country, and yet our health is declining. And the politicians have their heads in their hands and are thinking to themselves, how could this happen? We're prioritising spending on health over absolutely everything, our national security, our education, fighting poverty, and yet our health is getting worse and worse. And the chronic disease burden is the one that is particularly concerning. It feels to them as though there's almost nothing that they can do to stop this huge increase, 40 million people with a chronic disease by 2040. The Health Foundation study is absolutely daunting. If you look at the OBR or the Bank of England reports, the number of people falling out of the workforce due to ill health is due to increase, not decrease, over the course of this Parliament. It is an incredibly challenging problem. But the answer is at our fingertips. The science coming out of our universities and our leading areas of research and science and education is absolutely phenomenal. The treatments and the diagnostics, particularly early stage, particularly in prevention, are really, really encouraging. But the deployment of that insight is a real struggle. We're not putting to work all of the fantastic innovation that our leading scientists are delivering. And one of the reasons why there's a real bottleneck in getting good support, good coverage, good day-to-day encouragement to the patients on the ground in the community. There is a bottleneck because we've only got 30,000 GPs in the whole country, and that is simply not enough to deliver the care and the support and the day-to-day encouragement that people need in order to turn their health around. And that includes building people's confidence and their belief that there are answers to their health problems. That is not within the scope of someone in a hospital or even in a GP practice to be able to deliver. That needs people who are prepared to spend serious commitment of time over a longitudinal period. And that is where health coaching comes in. And that is where we've got a massive gap in our health system. And that's what politicians like me are beginning to realise, that the idea that more robotic surgery, more bariatric surgery, more interventions that happen in hospitals simply aren't going to be delivered on the scale necessary in order to turn around our health, the health of our nation. What we need are people who care who have insight into the way that people behave, who are able to take people on a journey to support their own medical treatment with behaviour change and kind of care and commitment that you can't find in the normal acute system. So you are absolutely in the focus of what policymakers are thinking about. I know that it may not feel like that right at the moment. I have heard from Isabella harrowing testimony of the challenge that many of you are facing, particularly in your interactions with the NHS. And that is a damn shame. Our health system is struggling. It is an arthritic, out-of-date 20th century health system. But I want to try to reassure you that there is a historical inevitability that the spotlight will move in this direction. And you may need to have a moment of entrepreneurialism and ducking and diving during this period of transition. I think a lot of you will have to find different ways of working, and the idea that there's going to be a tsunami of procurement from the NHS in the near future is probably not realistic. But the long term is in your direction. This is where health is going. Absolutely everyone knows it. And I just would like to ask you to be determined, ambitious, creative and patient in the pursuit of your career. And Isabella, you are a very, very powerful advocate for this cause. And I think that you are right. People will look at you, the work that you've done in future years, and see the incredible contribution you've made. And we are definitely looking at the future here. So thank you very much indeed for your work.